Welcome back, Titans, to another episode of EMS Lecture Series for St. Pete College EMT and Paramedic programs. Today we are talking about bleeding control and the application of a tourniquet. So, if we have attempted to use direct pressure and elevation, we still have uncontrolled bleeding. Our only other option, remember XA, B, C, D, E, we have to fix exsanguination prior to moving on to airway, breathing, circulation, everything else. We need to keep that blood inside of our patient. So we've attempted to use direct pressure and elevation and it's still uncontrolled. Our option is to use a tourniquet. So after we've cut the clothes off to identify the wound site, either you or your partner is going to hold direct pressure through this process. You can use an ABD pad, sterile dressing, 4x4s, whatever you can. For this, we're going to simulate that our patient has a uncontrolled arterial bleed on the right forearm. So we're going to take our tourniquet. We're going to slide our tourniquet over the patient's extremities because our tourniquets are only made for extremities, not joints or the core. We're going to go at least 2 to 3 inches above the wound site. So here I'm going above the AC, I'm going above the elbow joint. I'm going to go 2 to 3 inches above. I'm going to tighten my strap as hard as I can. Then I'm going to begin to spin my windlass rod until my bleeding stops. Once I have tightened it and my bleeding has stopped, I'm going to tuck the windlass rod inside the tourniquet. I'm also going to wrap the tail end of my tourniquet underneath my Velcro so it doesn't get snagged on anything, because we do not want that to happen en route to the hospital or the trauma center. And then I'm going to place my Velcro back on. Keep in mind that you can also use a second tourniquet, but once we place a tourniquet, we do not take a tourniquet off of our patient. Keep in mind, we are also going to notate the time and date here on the Velcro strap, and you also need to consider pain management for this patient. If you've ever had a tourniquet applied, these can be very painful over a long period of time, so consider pain management for your patients, and make sure we let the ED, receiving ED or trauma center know that the patient does have a tourniquet applied.